Welcome back, everybody, to the Steve&Bobby Show. As usual, I'm here with Bobby Glito, as usual, every day, day. That's E-R-D-A-Y.
These are good days for us.
That's right. That's right. Man, this stuff, I love this stuff. I love politics. I love this kind of stuff. It's great. It's great to talk about. It's great to discuss, and especially when I am across with someone that's very knowledgeable, especially what we're going to be talking about right now, which is about the vaccine and the different types of vaccines that are out, transportation, how they're going to get here. And Bobby Bliatu is in the industry, understands kind of the working and moving parts of this. So that's why it's great when we have someone like Bobby here. So let's do this. Let's look at the video. We're going to look at the video of some of the transportation methods, and then we'll get back and Bobby will enlighten us. I'm going to let Bobby roll on this one. He's going to enlighten it because look, I'm okay
trying.
with
I'm not all knowledgeable.
Well, you know more than I do. Let me put it that way. So just check out the video.
Completing its phase 3 trial, Moderna is now seeking emergency use from the FDA. The company said it found the vaccine to be about 94% effective against COVID-19. Novavax is also working on a vaccine. They expect to begin phase 3 trials in the coming weeks. But just how will those vaccines be distributed to millions of Americans? The challenge is the different storage methods. Debbie Simonson is the vice president of pharmacy for the largest hospital system in Louisiana, where they held a drive-through flu clinic as a test run for COVID vaccinations. She's written 7 pages of instructions to train pharmacists on all the possible vaccines. For example, Pfizer's vaccine requires dry ice to be kept at minus 94 degrees Fahrenheit.
So, okay, so this vaccine stuff, your wife's a nurse, my wife's a nurse, but you're in the healthcare field. You and by the way, didn't you do some drive COVID-19?
Tomorrow, actually, yeah.
You're doing that again, but you've done it already,
Oh, yeah,
right?
no, yeah, we do them. Yeah,
a few times, right?
Yeah. Oh, no, every day.
So shout out to Bobby doing the locals, man, helping us out here in the Fresno, California, doing some of that. It's important work, man, really. Appreciate that. That's stuff that needs to be done. So help me out on this COVID-19 stuff, because, man, this is one thing I get, even on with my personal page and stuff like that, I get tons of people that ask me about this, like, and I honestly don't know. Even Camille, my wife, who's in the medical field, she knows what her company's telling her, where she works. But, is it the same? Enlighten us on this.
It's got to be this. It's got to be different.
Yeah.
Everywhere, because, look, we complain on the show about how this administration has handled this pandemic and what's been going on.
Yeah.
So there isn't any clear instruction. There's only a bunch of, oh, this is what it should do. This is how we have to handle it. So we really don't know it, and things change week to week.
Yeah.
Right. And you guys are getting confused. I get confused just the same. This is what keeps me up at night, researching, checking, talking with my providers, talking with my front staff. I mean, people say I don't get on the front lines. I've been out there.
Oh, yeah.
I've been PPD'd up and talking to the patients. Getting them registered. Getting them tested and doing all of that stuff. I mean, I like to see it from all areas to know what's going on, because when it's time to implement these things, you got to do it as best as possible.
So you're the kind of leader that likes to be in the trenches. You'd have been a good military leader.
Or dead, but anyway. I believe you got
Damn,
you might got to die, but no. But the thing is this, is that what is kind of consistent now is that we should have the vaccine distributed in about a week, during the second week of December. So we're not too far off from that, during the second and third week of December. So once that gets distributed, each state and then county will have their own rules of how they distribute it to healthcare workers. It's supposed to be healthcare workers. It's supposed to be now healthcare workers. There's not even enough vaccines. We've talked about this. There's 50 million coming, 100 million coming out from Pfizer, right? Mm-hmm. That's how many doses we bought. It wasn't through Operation Warp Speed, but America, when I say we, America, is 100 million doses. That's for 50 million people, because it takes 2. So they have these categories of what they call like high-risk healthcare personnel. High-risk healthcare personnel means you're in contact with patients, or you're in contact with patients that have COVID, right? I don't know who's going to regulate it. I don't know who's going to do what.
That was my question. Who's going to?
Right.
Who determines that? The CEO,
There's got to be, the county and
guidelines.
how the county does it.
Yeah.
And, with the county just finding this stuff out right now, I'm sure counties all across America are going like, what do I do? And the way there's snail mail and everything else that happens, some counties are just, what do I do? And they haven't even been told that they're going to get it, I bet you. Right? So, in both counties that I do kind of serve, they're very large counties in comparison to the rest of the world, of the country. So we may be the first in line to hear about this stuff and start the planning and implementation of what is going to happen with our healthcare facilities within our locales. And it's still kind of unknown because we haven't been given names. We haven't, to provide who we, how many we need, who we're giving it to. And hopefully by tomorrow it changes. I mean, again, we're recording this on Thursday and tomorrow's Friday. By the time you see this, it's very possible that we might be turning in our names. But
isn't
it's
there,
only a week away.
okay, so here's a real quick question. So there's a few companies that are doing this, right? There's
Yes.
Moderna, Pfizer.
Right.
And then what was the
AstraZeneca.
Okay, AstraZeneca.
So, yeah, there's a lot
Those
of
are the
folks-
main ones. I know there's a lot of companies that
There
are
are
doing
two that have been finished.
the main ones,
are,
right?
are Pfizer.
Okay.
They're done.
Oh, so Pfizer's done.
Yeah, Pfizer's done. Pfizer should be distributing real soon here,
So-
which is the one in December.
On the Pfizer one, I want to ask you a real question on the Pfizer one. On the Pfizer one, from what I'm hearing is they had nothing to do with this Operation Warp Speed,
That's
right?
correct.
So this was totally independent. There's something they was working on a coronavirus vaccine as well, right? Oh, okay. So this is something they was already on.
Right.
Oh, I see.
But America already had a pre-sale, a pre-purchase buy. Right?
I got you. Okay.
And it was the same deal with AstraZeneca. But it was a deal, and they got no money. Pfizer made the claim, I don't know if it's true, made the claim that they never received any American grant money to produce the product. So this is all
that's
their
their
own
promotion.
investors. This is,
Yeah.
right? And for them to say something like that, I don't know. Are they saying like, yeah, we even did it on our own, or are they saying so we have control to charge what we want after that $100 million price?
Is Pfizer a German? It's a German company, right?
I think it's here. I think
Oh,
they're
it's
based
an
here in
American
America.
company. Okay,
I believe
all right.
so. I mean, they may have places in Germany and stuff because
Okay.
I know they're shipping out of the country.
Okay.
There's some, other global issues that we are having about the availability of this.
Yeah, because they're forcefully advertising this idea that they were not under this warp speed. So I think that has a lot to do with financial reasons
Yes.
and not being under that
see.
umbrella.
We'll see. Again, Congress should have been putting something
Yeah.
together to make sure that we are able to afford this vaccine for absolutely everybody who wants it, and to make sure that it's affordable.
Yeah.
Right? Can we get the same volume deal that America got when we bought the 100 million? Right? Moderna is a part of Operation Warp Speed, I
Yep.
believe, and
Yes, they are.
Moderna should have their stuff distributed by the end of this month or the beginning of January.
And AstraZeneca is.
No one else has a vaccine done yet.
Yeah, okay.
Right.
Now, I heard something really disturbing I think it was yesterday, it was on CNN, where they were talking about, because we first started hearing remnants of this back, I'm talking about this COVID-19, back in December, November of last year, right?
Yeah.
Is that correct?
December, but yeah, like just rumblings. Like
Rumblings of it, right?
Of some disease, yeah.
Okay, so I was watching CNN yesterday. I do watch CNN. I was watching CNN yesterday, and they're going through a lot of the blood donations from 2019. And in that blood, they have the antibodies of the COVID-19, a lot of that blood. So that they're saying that this has been around a lot longer than they first thought. And the reason why I bring that up is because I wonder if that's the reason why, because I'm like, Pfizer's been working on this for like 8 months or 9, or maybe it's a year now, I think they said. So I'm like, what got them to work, to get on this prior, you know what I mean? And then I wonder if it's because they maybe already knew.
I don't know. I don't think so.
You know what I mean? Because
Yeah.
I know we're in December already.
Yeah,
we're
but
talking a year.
I think like in April or May, they really got together and everyone just started working on a vaccine. I mean, that's when everyone's getting upset.
put all
Bill
their-
Gates putting all the money into
Yeah.
these companies to build a vaccine, but everyone started to try to build a vaccine, get all the stuff they can get. And so I don't know if any of that stuff has been proven yet, whether the antibodies are the same antibodies that are there now. Because there are other coronaviruses, so, the novel coronavirus in its own is unique from the rest, right? And we're, hope there's only a couple unique strands. So hopefully the vaccine can work for everything that's out there now, and we don't have future mutations, which is a whole nother conversation. But in this piece here about the vaccines, The refrigeration is why, one thing about refrigeration, why it's important is because the amount of dosages that we have available. Vaccines go bad every day because people leave refrigerators open, they expire, they're not used. And I think a lot of times it's just like, power outages and the generators weren't working, so then the vaccines were destroyed. It's very costly if that happens this time, and not costly from the point of view of money, but costly from the point of view of what it's doing for the community,
and helping,
right? And how we can boost immunity and slow this curve. Just to give you an example, we are going through training right now through the drug companies of how we're going to get delivered the immunizations from the drug companies and how we are supposed to take care of these and how we're going to order these, okay? And that's when it comes to being for the general public. So we're getting training now for what's going to happen in about 6 months.
Wow.
So what I'm saying is, it is my prediction and my thing is that it won't be till April or May,
Until
at the earliest.
you can go in and get one.
Yes, so your primary care provider is going to have it because that 100 million right now, I believe, is pretty much reserved for people. It's sad, but it's like in the club. We've had this debate over and over again. Who deserves it first? And it appears that they say healthcare workers. What does a healthcare worker mean? They try to put the definitions out, but we'll see what it is. And it's a hard one because you put people like myself in a hard position of telling someone who wants it, no, they can't have it, right?
Yeah, because like as a CEO of a medical organization like the one you have, you know what I mean.
Yeah.
Well, you're in charge of a medical organization, and then you have all these employees under this umbrella. So it's like, does a janitor get it? Because the janitor got to pick up stuff.
I would say according to their definition, because those who have contact with biohazards,
it has to be a janitor, right?
I think janitors.
The janitor has the same amount of exposure as a nurse would, or a doctor.
Yep, but
in my opinion,
definition, medical receptionists don't. So
yeah,
in the way that we provide, if we can detail, someone might be infected, they don't come into the building. We have all of our testing outside.
I think everybody in a hospital should be given it.
Right.
Everybody who works in a hospital or a clinic.
In the state of California, there are 1.1 million high-risk healthcare workers.
Just the workers by themselves.
You're talking the ones that talk to the patients, that touch the patients. 1.1, and that's just
you can't even
acute
provide
hospitals.
Yeah.
That's not even counting the primary care clinics, surgery centers.
So it's
that's
impossible.
Not counting dentists, so that's what I'm saying. Is like we have no clear direction, but we have what we have at our disposal. We got to do something now, and that's what we have to get together and do that nitty gritty, that work. For the budget, Congress will lock themselves up. Right? We saw that. Right? They'll lock themselves in there, close the doors until they got a solution.
Yep.
This is more
when
important
it comes to saving lives and vaccines.
This is more important than the budget, right? Because what's happening is not just people are dying, but people's businesses are being shut down. And it's not because people want control. It's because, honestly, a lot of people don't know what to do. So we need clear leadership, and we need an answer now. We have to do something now. So, Congress, lock those doors up, come with something. Get your staff to lock the doors, work that overtime. I approve. I say go ahead. Work that overtime and get it done because we must come up with a solution, right? Let's go. So, I can help you want. Steve will help, right?
That's right. I'll help anytime. Let us know. Or you know what? This one thing, even with this, if there's information that you guys are seeking, let us know. Put it in the comments. We will. I'm telling you, the man that sits across from me, he gonna find out. That guy will find out, especially when it comes to medical stuff. He's real knowledgeable on this kind of stuff, and he knows where to look for stuff like that. So make sure if you guys have a question or there's something that you guys want answered, let us know in the comments. Maybe we're
completely off.
Yeah, but maybe our approach here is not right. Maybe you don't look at it the way we do. That's okay too. Maybe you can enlighten us on that as well. So, these things are important though, and it's important that we all sit down and discuss it because right now we are in a very catastrophic situation, not only for our economy, but we are losing. We had 2,600 deaths yesterday.
They're saying 2,800.
2,800 people that have died in a single day. If you remember when this started, everybody says, well, 30,000 people died from the flu. Remember that? Remember that? We don't hear those guys no more. Those guys are real quiet now. This is serious. And the one thing about it's only 1% that are dying or whatever, right? 1% of damn near 370 million people is 37 million people.
3.7 million people.
Huh?
3.7.
3.7. What did I say, 37? 3.7 million people. That's a lot of people for something that's just new, just come out of nowhere. That's a lot of people. I mean, if there were that many people dying in car accidents or because of a failure of a wheel lug, they'd have that thing fixed. I'd have a recall, and I'd be in there fixing my car. So, look, this is serious. Somebody dying it's not a political statement. Okay, it's not. You know, us fixing this situation needs to be fixed. It's got to be fixed. And we got to figure it out. We got to come together. If we're not going to agree with everything, you're not going to agree with what I think, and I'm not going to agree with maybe half the stuff what you think, but we can surely come in the middle.
Yeah, sacrifices are going to have to be made because whatever you want to think, sacrifices are currently being made.
Yep.
There are a lot of places when I talk about universal health care. We have it, but sacrifices are being made, so we need to make it better. Today, sacrifices are being made. You're looking at 2,800 deaths yesterday, and every other day that's happening. Those are the sacrifices that we are making, and it's going to increase. You look here in California, Yuba, I think it's Sutter County, their hospital is overflowing now. They
Sacramento.
have no more bed space. Sacramento is at 70% bed space, going to be 80 by the end of the month. It's growing too fast. All together as a state, we're like 39 or 40% ICU is being taken. We have room for a little bit when you talk about a statewide, but it's countywide, we don't have it. So in different areas. So we have to take this serious. And we have to look at where we can sacrifice and what we can best make it out of. But again, it still comes down from the assistance that we get from the federal government.
This is what happens when you have an impotent government. Really, I'm serious.
This is what happens with party polarization.
Yep.
You know, you get these lame duck sessions.
Yep.
It's just stalemate.
Yep.
Because everybody wants to win. I don't care who gets to win. I've tried to, until politics, I'll be humble. I mean, truthful about it. Until politics, I didn't really care if people knew what I did.
Yeah.
I didn't.
Yeah.
And I think you do things without getting credit, right? Unfortunately, when you run politics, people have to know who you are and they have to know what you did, so you put it out there. And it took me a long time to say that's not bragging. It's just kind of like saying, hey, this is what I've done and this is what I continue to do. But we need to now, who cares who gets credit? Save us, the American people.
Well, anyway, I appreciate you guys for tuning in, of course, to the Steve and Bobby Show. As always, make sure you guys tune in to Mad Talk TV Studios, some of the programming that we have there on the Facebook page. I say this every single time because it's important that you guys support your local talent that we have, especially in the Mad Talk arena. So I appreciate you guys for watching the Steve and Bobby Show as usual. And make sure you guys tune in. What's next week? Tune in next week. It ain't Christmas. I had to make sure I knew what I was talking about. So I appreciate you guys for watching the Steve and Bobby Show. I'll see you guys on the other side.